Last update relates to the homeless. We have obviously seen the challenges and situations that San Francisco had in one of their shelters. That type of situation where you had an overcrowding in a congregate care setting with the inability to do physical distancing is what led the city, the Regional Task Force on Homeless, the Housing Commission, and the county to move forward with the convention center to get individuals out of a bad situation into a less bad one where we could ensure physical distancing. We also took early actions and steps to put public health nurses in our shelters to do temperature checks and look for symptoms and immediately get individuals who exhibited symptoms or fever out of those settings for further evaluation. We also had public health nurses with our homeless outreach teams for those who are unsheltered. We have public health nurses and teams in the convention center daily doing screenings and temperature checks and monitoring, and a system and protocol in place that anyone who exhibits symptoms can be moved out. But it was concerning today, the report out of Boston, where they went in and tested asymptomatic individuals in their shelter and determined a number of them have been positive. This is why we have been putting in place for the last few days a process in partnership with the Lucky Duck Foundation and Family Health Centers to test every single individual in the convention center. To go through whether they were all asymptomatic. If they have symptoms, they would already be removed. But we want to test those. We've got a system in place for anyone who tests positive to be immediately isolated and then transported to a public health motel room where they will receive care and help during their recovery phase. But we continue to do everything proactively we possibly can. We generally have not been in a position to be able to test wide groups of asymptomatic individuals, but thanks to the generosity of philanthropists and the partnership of a health system, they're able to do it. We think that it is appropriate, we think it is proactive, and we think it is an additional step we can take to try and protect these populations. They're starting today. The hope and estimate is that they can do 150 tests today. As we get those results, we will share those with you, separate and distinct from the rest of the results that we share.